Okay, Dr. RJB, I wanted to talk a little bit about addiction and rehab. Um, you know, one of the things that's been pushed in medicine is the to decrease the usage of narcotics in medicine. We know that there are many people who started out on narcotic pain medication and then wound up getting addicted and dependent on those medications, and some even wound up switching from the prescription narcotics to the illegal non-prescription narcotics. They may go from a narcotic like, let's say, Vicodin to a non-prescription like heroin, even. So the in medicine, we try to limit the use of narcotics if at all possible. Um, I know my policy has been when I was taking care of patients in the hospital and they had, let's just say, a surgery or something, and they needed something for their surgical pain, that I basically prescribed no more than medication that could be used for like 1 week. And if a patient came in after a week and wanted to get another prescription, I usually tried to talk them out of that, discussing the risk of addiction at that time. Uh, uh, I have seen prescriptions that were given for 90-day supply. It wasn't going to be me as a physician to do something like that. I think that the state that I'm living in, they have figured this out. Medicaid has figured this out. Medicare has figured this out. And the last business that I worked at, they also figured this out. And there were restrictions given on the use of narcotics. Sure, people can ignore the restrictions, but they take the risk that if there's a complaint filed against them, that they might lose their license to practice medicine. So, it's just one of those things that you have to be very careful about. If somebody has become addicted to pain medications, there are pain management places in the area that can help people, and try to get them to get them off of their narcotics, so that people can use other means of taking care of their pain. Um, uh, Definitely, if somebody is on the use of illegal drugs for their narcotics like heroin, it becomes a little bit more difficult to get them off of their illegal drugs. And in those cases, it has to be the person themselves who decides that they want to go for treatments. So if somebody is motivated, there are programs that can help people get off of their narcotics, um, uh, rehab places, clinics that do that work, and that people can get help if they want it, definitely.